So these ones are, he was our first suicide after we came home. Yeah. I refuse to ever go back to the VA. I refuse to step foot in their building because I just don't feel like they actually were there to take care of me. I'm a combat veteran and a Purple Heart recipient, and I'm getting treated this way. What are the rest of my brothers and sisters being treated like? We've had multiple suicides from our unit after we got home. Is the reason because they couldn't get care at the VA and the VA didn't treat them like a human being either? And I think that's really when the anger set in. Joining the military was born out of a lot of pain and a lot of struggles. I grew up very poor here in Montana, and I had a very abusive stepfather, and that was my way to just get away from that situation. So I joined the Army at 17 years old. We deployed to Afghanistan in 2012. You can see here, this is where the RPG actually detonated. I was actually in my tent on June 26, which was 6 days after we landed in country, when an RPG came through the tent that I was sleeping in and detonated about 5 feet from where I was. They pulled a bunch of shrapnel out, but being that I'd only been there for 6 days, I didn't want to leave my guys that I had trained with and built up for this deployment, so I decided that I was just gonna stay, and I continued to tear myself apart just so I didn't have to leave the guys that I trained with. The culmination of isolation is death, and as veterans, we tend to isolate ourselves. So one of the reasons I wanted to stay in Montana, I wanted to be here, is that I had that ability to isolate myself. We typically are right there at the top between us and Alaska at having the most veterans per capita. And I think it really comes down to the fact that veterans kind of get that solitude. You can be out hiking, you can be hunting and fishing and camping, and just get that opportunity to just reconnect and ground yourself. So I came back to Montana and got connected with the VA, and the very first surgery that they told me that they were gonna do, I had to have the plantar tendon in the bottom of my left foot repaired. They didn't even repair that tendon, but pulled 2 joints out of my left foot, and now those toes are fused together. There's still no answer as to why they needed to do it, but my next 2 surgeries were just to correct the issues that came from that first surgery that was not even supposed to happen. And in the meantime, they're putting me on more medication, more antidepressants, more anti-anxiety medication. I really still couldn't walk. I still couldn't function as a human being. And that led me down the path of suicide. If I have no hope for the next 40, 50 years that my life is gonna be any different than what it is right now, suicide became my option, and I attempted suicide through that process. When I went to the VA afterwards to say, I need an appointment, I need to talk to somebody, I need a therapist, a counselor, somebody, they told me that I'd have to wait 6 months just to get a mental health appointment. I knew that if I had to wait 6 months, that I wasn't gonna be able to hold myself back from attempting it again and again and again until I finally did succeed. I wanted to get the help that I needed. I saw that person for a couple of months, and then they quit, and I got another provider, and you start over from square one, as if you just went to therapy for the first time. And I did that 6 times before I finally gave up and said, well, this isn't working. So I attempted suicide a second time. And it wasn't long after that that I had a friend who let me know that I could request to see a therapist outside of the VA. Sure enough, I was able to get an appointment, and I actually still see that therapist. I had some friends, and we'd go out in front of the VA and we'd hold signs about them misrepresenting the reporting procedures. Somebody from CVA reached out to me at that point and let me know that we're actually trying to fix this from a policy perspective. I absolutely wanted to help out as much as I can. A couple months after that, they hired me on full-time. My role at CVA is the strategic director for Montana. We are now on our way to talk to veterans in Bozeman and leaders in the veteran community about VA reform and the healthcare that veterans are getting today. I love working with CVA because We know that there's a problem, and we actually come to the table with solutions and a path forward. The VA healthcare system in Montana is very broken right now. In Montana, the average wait time is around 7 months to get an appointment, and there's nobody that they can go see unless they want to drive hours and hours and hours just to get to a mental health appointment, when they should have the opportunity to see somebody who's right there in their local community. Veterans, they want those options to be able to pick and choose where they get their health care. And the VA just has created barrier after barrier to getting that care that they need. The solution here really is to put the choices back into the veteran's hand and allows veterans to find a provider that's either at the VA or in network in the Care in the Community program, schedule an appointment and go get seen based on the things that they need. And so partnering with CVA, we can help ensure that every single veteran will get the care that they need, when they need it, and how they need it. Veterans across our state here in Montana and veterans across our country are suffering, and we're seeing the suicide rate continue to climb again, and we're going to continue to see the same trajectory if we don't put the veteran back in charge of their health care. The goal of the VA was to ensure that the men and women who signed on that dotted line, who put their lives on the line for our country, for our freedoms, we were going to take care of you because you deserved it. You've earned that right. And that's not what the VA is doing. At the end of the day, veterans deserve more choices and more options within the health care that they have with the VA. I've already lost several of the members that I've deployed with to suicide. I've seen it happen. I'm affected by it. I've attempted it before. Veterans absolutely deserve more choice and more options.